all of a sudden, I'm hyper aware that I am in an auditorium theatre full of about 50 naked dead bodies, and I'm going to be dissecting them for the next 3 hours. Hi YouTube, welcome to my channel Aesthetic Academic. My name is Aashima and I am a medical student that loves fashion, but I also love pondering the philosophical quandary of aesthetics. I thought it would be irresponsible of me to make a video and not do a COVID-19 update, so here it is, a little quick one. So it is March 15th, I'm in Melbourne, Australia, and so far I am not at all panicking about COVID-19. There's very few reported cases in Australia right now, so there's no need for panic. But having said that, I'm washing and sanitizing my hands as frequently as I possibly can. I think there's two main schools of thought that I've seen on the internet that I think are detrimental and will impede our resolving of COVID-19. And the main ones are the doomsday prepping and also the complete nonchalance. I think they're both not helping. Not that it's anyone's fault, because it is so hard to understand the information that's coming out. You basically need a degree to actually even figure out what the hell's going on. So it's absolutely not your fault, but I'm here to clear that up. So as far as doomsday prepping, you are really just disadvantaging everyone who, can't afford to buy like a surplus amount of stuff and has to, eat like week to week, like normal people do that. And by taking all the food from the supermarket, it's actually really bad for everyone, our whole society. And even like the buying up of the hand sanitizer, for example. Like, are you gonna sit in a kiddie pool full of hand sanitizer? Is that your strategy? Because that's actually not gonna work. Your best bet is to make sure that everyone doesn't get infected, which means buying a reasonable amount of hand sanitizer so that everyone else can also buy hand sanitizer. And then that way it won't get transmitted around. But if you're just buying a whole Safeway full of hand sanitizer, then that ain't gonna save you when literally everyone in your street has COVID-19. There's no amount of hand sanitizer that's gonna save you from that. So you want your friends and your family to be safe, and you don't need to buy everything in the store. It's okay, just buy a reasonable amount. Secondly, the complete nonchalant family of people. I understand you, I'm not judging you. I used to be you because it did take for me to have a degree in science to understand why that would be an issue. So I'll explain to you how the penny dropped for me on that regard. So I used to never get the flu vaccine. I would be like, oh, I'm fine, I'm young, healthy, whatever. I'm not gonna get the flu, no worries. I'll just take a couple of days off work. And then we were learning about public health one day, and the teacher was telling us about how, you aren't getting the flu vaccine for yourself. You're getting it so that you don't get other people sick and then they die, like older people and vulnerable people. And I just remember being like, duh, of course I want to help other people. Like, of course I'm going to get it now. Like, I didn't know it was like a public service, or I sort of think of it as like my service to society now. And that makes me happy and I want to do that. So that's what it took for me to understand that. And it's not common sense, so you're not going on your holidays for you. Like, I know that you're healthy and you'll be fine, and that's bloody wonderful, amazing. But it's about everyone else who is potentially going to die from this, and they're the people that you have to think about. If it's your grandparents or, a friend who's going through chemotherapy, they're the ones that we're worried about. So by not going on your holiday or not going to that event you were going to go to, you're actually doing like a great public service, and you can really pat yourself on the back for it. And you can just sit at home, watch TV, save a few lives, just a casual Saturday. That's pretty neat. So now into the meat of this video, which is the vlog part. I have been at uni now for 2 months. I'm in week 8 now, and I'm only just starting to understand and wrap my head around fully how they're teaching us what we need to know to be doctors. Because after starting the course, I realized that although I had watched a lot of vlogs about other people and what their experience of medical school was like, I still didn't have a very clear picture of what that learning would look like. So I'm going to try to break it down. And then there's been a few firsts this couple of months, including my first human dissection, my first clinical placement, and my first time learning at medical school. So I'm just going to touch on all of those topics. The structure of how we learn is, so we have our lectures in which we learn about diseases, and we learn about them in organ system blocks. So our first block is cardiac. So everything we're learning about this month mostly is about the heart. And then we have tutes. So lectures in a theatre, and then we've got tutorials. One of our tutorials is more fleshing out the disease mechanisms that we've learnt about in our lectures. So we just go into details about a few in case study groups. So that's one chunk, learning about the biomedical side of medicine. Then we have another tutorial called professional practice, and in that we discuss stuff like ethics and consent, and the human aspects of being a doctor, and how to learn better and how to communicate and how to give feedback, so that sort of stuff. And then we have another class where we learn the practical skills of being a doctor and stuff like using your stethoscope, how to take a patient history, how to do a cardiac exam, stuff like that. So we've got learning the diseases in one class, and simultaneously in other classes we are learning how to take histories and how to find the signs for the diseases that we may have been learning about in the lectures. And then the last component, all of that, is that we have placement, which means that they put us in a hospital and a general practice. So 2 days a month we go into a general practice, and 1 day a month we go into a hospital, and then we get to practice all the skills that we've learnt in class in a hospital. So on Thursday we did our first cadaver dissection. A cadaver is a dead body, so that was the first time that I've had to do something like that in anatomy, and it was a once in a lifetime experience. And I'm going to talk you through all the emotions I felt leading up to that moment, and then how I felt on the day as well, because I didn't know what to expect, and it was really, I'm just going to get into it. So I've been afraid about this dissection. We've known about it all term. This is just our first class dissection. We're going to do it. We're going to keep doing it for the rest of the semester, but I was definitely feeling afraid. I was afraid because I'm an emotional person and death is an emotive topic. So I couldn't anticipate how I'd be feeling on the day doing a learning activity, but with a dead body. I've never been in that situation, so I didn't know how that was going to feel. For my undergrad, we did prosected dissections. We had prosected dissections, which means that someone else had already cut the body and we got to look at the organs. But at that point, when you're seeing a lung, while it is still a human lung, it has been removed from the body. So it's not as an emotionally intense experience because you're just seeing one portion. It's easy to de-identify the person from the organ because you don't see the person. But this is the first time that I actually had to physically do the cutting. So I was like, oh my God, what is that going to feel like? Am I going to vomit? What is going to happen? I've never been in this situation. What the hell? I think the school did a really excellent job of making us feel comfortable about the dissection. So they showed us a video a few weeks ago that another medical school or just a university had made about their body donor program. And in the video we got to see people who were donating their bodies while they were still alive, and then they spoke on camera about why they were doing what they were doing. And then we got to hear the student perspective as well of how they felt doing the dissection, and also a bit about the families of the deceased and how they felt about their family or friend donating their body. And to illustrate, there was a gentleman on the video who had lifelong medical complications. He had always been unwell, and he was talking on camera about how he felt that the medical community had done so much for him and spent so much money on him and taking care of him that he wanted to do one thing that was going to benefit medicine and society that he could do, which is donate his body. And that was just so moving to me to see, and then to think about wow, all these people that we are going to get the privilege of dissecting, their people, and they had lives, and they didn't get to have their bodies at a funeral for themselves. That's a big sacrifice. They took somewhat that closure from their family so that we could learn, and that was just enough. Like, I can't deal with that. Like, that is like another level of trust that they have in us as learners. And I and my entire cohort, everyone absolutely wanted to respect that 100%. So yeah, felt very grateful to even be somewhere where that was a possibility for me to learn that way. So cut to Thursday, 2 p.m, the day that I had been looking forward to. My curiosity was like at an all-time high, which is normally pretty high, so that was quite high. High enough for me to, you know, sort of push aside the fact that I was going to be in a really uncomfortable situation for myself. Another factor that was making me feel really uncomfortable was that the last time I saw a dead body, it was 2 years ago, and it was my dad's, and I watched him die, which I'll get into later in the video as well. But so yeah, I was like, wow, I haven't seen a body in a while, and the last time I saw it, it was a pretty not good time. So, oh my God, I don't know what it's gonna feel like. Is that gonna like dredge up those feelings? Like, I don't know. Yeah, that was what was on my mind. So we're in this hall, and then the tutorial teachers, they give us a little talk about the procedure, and then we pair off into our smaller groups, not pair off, group off into our smaller groups. And so each group had a teaching assistant and a table with the body on it. And then they peel back the covers of the tables, and all of a sudden, I'm hyper aware that I am in an auditorium theatre full of about 50 naked dead bodies, and I'm going to be dissecting them for the next 3 hours. Another part of the experience that I didn't think to anticipate was the fact that they were naked. And I mean, of course they're naked. We're learning anatomy. Like, of course they're naked. That's so stupid of me to have not thought about that. But any other time I've seen a dead body, it has been fully clothed. Like, not only am I looking at dead bodies, I'm looking at them in a state that I've never seen them before, which was, yeah, I don't know, it didn't like scare me, but I was like, oh, that's a thought that I didn't expect to have. It was weird. I felt weird. So our first task was to look at the body. We're doing a thorax dissection as we are learning about the heart right now. So we had to look at the body, see if there was any scars or a defibrillator or something like that, and then palpate the landmarks that we've been taught to palpate. Palpate just means touch. So, you know, touch the ribs, see what number of ribs you find, etc., stuff we learned in class. And, you know, there was people who'd done dissection before who were seemed very comfortable, but me, I was very gingerly like, oh yes, quite softly touching, you know, I was afraid. There's also a smell to the room. It's not very, very bad, but it's distinct. Like, I couldn't ever forget that that was the smell of that room. And it felt, you know, I felt like knots in my belly standing there and like palpating this dead body because, you know, she was so human, you know, she had hair and she had like a little bit of makeup left over from where her funeral would have been. So stuff like that was like, oh, you know what? I'm wearing makeup today. And this is going to be me one day. I'm going to die. Wow. The next part of the dissection was creating a window of skin that we could peel back in order to look at all the layers of the skin through to the chest wall. So we had to make an incision with a scalpel and make like a little square that we could peel back. So peel back first the skin, and then peel back the subcutaneous, so the layer under the skin, which includes fat, and then the different muscle layers after that. And I just promised myself that I would cut some because that would probably make me feel less afraid. So I watched some other people do it first. Someone made the first incision and reflected some of the skin, which was, you know, it was really, I was off-put. I felt unwell watching it happen. But actually when it came to my turn of doing it, I was feeling far less afraid because, you know, I was so intensely focused on my task at hand, which was to finally cut. Also, by the way, being a surgeon would be the hardest job ever. But, you know, trying to cut away this piece of skin, yeah, it gave me something to focus on, and I wasn't looking at the bigger picture of the body. So yeah, I was kind of fine doing that. I felt for some layers, they suggest that you just grab it and pull it is like easier than trying to use a scalpel to do it. So that was definitely like, felt more uncomfortable to me to hear that ripping noise of flesh, you're ripping flesh. But yeah, that's just part of the process, and that's just how I felt doing it. But it was really good for my learning, like stuff that I'd heard in lectures that I was like, what are you talking about? Like, for example, the description of a muscle being like hands in pockets. I heard that in a lecture and I was like, what are you talking about? Like, I don't really know what that means. But then we saw it on the person, and it was like you can see the direction of the muscle, and it is in the direction that someone would be putting their hands in their front pockets. And then I was like, oh, that's what you mean by hands in your pockets. I didn't know what you're talking about in that lecture. So definitely solidified a lot of those concepts for me, which was really, really useful. We didn't get through all of the parts of the dissection that we were meant to get through on the day. So we left it on kind of a cliffhanger. So the next part where we were supposed to finish was to reveal the thorax, but the inside. So we clipped the ribs here and here, but we have to clip them all the way up next week to flap open the chest to reveal the organs on the inside. So yeah, cutting the ribs actually wasn't as awful as I thought it would be. I committed myself to cutting a single rib, put myself out of my comfort zone. And we had like a tool that sort of looked like secateurs. And yeah, it was about half as disturbing as I thought it would have been. So that was a nice surprise. I am very much looking forward to the next dissection where we get to examine the organs. That will be super interesting. And it really motivates me to really commit a lot of time to studying prior to the lab, because I want to make the most of this opportunity that this person has been so kind to give me. So I'm going to study as much as I can and prepare so I get the most amount of learning from it. That was my experience. It was pretty insane. So moving on from that, I wanted to talk about how I felt learning about the cardiac system. So I love learning about the heart because for a simpleton like me, it is probably the most easy organ to understand because what you see is what you get with the heart, basically. For example, if you're learning about the kidney, you're learning about the units of a kidney are very small, that you can't see them with a naked eye. So you learn about all these concepts, but it's very abstract because you'll never see that with your naked eye. When you look at a kidney, you're never going to see the systems that they're talking about because they're just too small. With heart, blood in here, blood out there, it's plumbing. So that's why I really like it. It is at my level of learning. But at the same time, my dad died from complications from a heart attack. So I'm super aware of feeling funny about learning about the heart. And it's been catching me off guard a little bit. So there'll be moments like I'll be in a lecture theatre and we'll be learning about STEMIs, which is a type of ECG reading which is indicating that someone is having a heart attack. And I just know that was my dad's ECG reading. So it's really sad to think about that while I'm trying to learn and be like, oh yeah, that must have been really painful, or that was really horrible. And I can't divorce those thoughts. That thought is going to always occur to me when I see that ECG. So that's pretty sad. I guess in the positive though, that's going to mean I'm never going to forget that. So good, I'm going to be really good at seeing that ECG reading, which is definitely a good thing. And another thing that caught me really off guard was that I was sitting in a class where we were learning how to take a history on chest pain. And one of the questions was, how many pillows do you sleep on? It's like a super random question, right? Like when I heard that, I was like, well, why are we asking them what's it to you? What it is to us is that if you have fluid in your lungs, then you don't want to sleep horizontally. It's harder to breathe. So you'll prop yourself up on a few pillows so that it's easier for you to breathe while you're sleeping. My dad, literally my whole life, slept on multiple pillows. The whole time I knew him. But I just didn't know that was bad. Like, how is a normal average person who doesn't have a medical degree or know someone with a medical degree supposed to know that that is a bad sign? I can't shake the feeling of feeling like I'm learning all of this knowledge just too late. Like if I had learned it 5 years ago, then maybe I could have encouraged my dad to go to the doctor, but I just didn't know. So I couldn't do that. And now my life is different. So that is just something that I have to grapple with. And, you know, it's going to take me time to get over that feeling, I think. But on the plus side, which there is always a plus side, it is in those moments that I feel the most motivated to continue to pursue making this channel and building a platform where I have the capacity to make really good videos and disseminate really high quality health information. Because what good is all this whiz bang science and all our medical advancement when it is not accessible to a normal person? So if I can create a way that I can help people recognize risk factors in themselves and risk factors in their friends and family, and so they can seek medical attention before it becomes a real massive problem, that is just like the ultimate goal for me, you know, to help people understand health and to learn how to be excellent patients. That's the dream. If you think that's a good mission and you would like to help out, you can like and subscribe to my channel so I can continue to make videos and help educate people with the wonders of social media. The last first that I wanted to cover in this video is my placement. So I've been doing 2 days at a general practice a month and then 1 day at a hospital, and I'm just loving it. It is so fun and interesting. I'm an extrovert, so I feel really alive and energized when I'm around lots of people. So it's really like scratching that itch of my personality, I suppose. And it's been awesome to be able to talk to patients. I was really surprised by how nervous I was to take a history, because when I first started the course, I thought that would be the easy part for me, but it's actually not, which was a sneaky, sneaky surprise. I suppose because I've always been quite good at talking to people, I thought it would be like that, but taking a history is actually not the same as just having a chin wag. You actually have to really concentrate and think while you're taking a history, because you're trying to listen and process all at the same time. So yeah, I've had some very awkward history taking and some very patient patients. But yeah, for now I'm awful at it, but I'm giving it a crack, and it's been really exciting to be in situ, like in a hospital or in a general practice, and like get that feeling of what it's going to be like to enter the workforce. This next week, I am going to see my first ever surgery, which is so exciting and I cannot wait. And then the following week after that, I have my first exam. So it's a few more firsts on the horizon, but all good stuff, all stuff that I'm like looking forward to. And I just can't believe that this is my life. Yeah, I feel so happy, and I'm so glad that I worked as hard as I did to be where I am today. And if you're someone who is wanting to become a doctor, like I am loving it. I'm loving doing this course. I feel so lucky that I get to get the education that I'm getting. And I feel so lucky that I am going to be able to assist people every day for the rest of my life. Like, that is really humbling. So if you're slacking off right now, hit the books. It is so worth it.